professor in the School of Public Health and Social Policy, and I have the privilege of being the school's director. As we begin, I would like to acknowledge on our behalf, with deep respect, the Lekwungen, Songhees, and Kosepsum and Esquimalt peoples on whose territory the University of Victoria stands, and the Lekwungen and Wasanich peoples whose historical relationships with the land continue to this day. Territory acknowledgements are a reminder for us to think about how we have come to be on the traditional territories where we are, about the ongoing impacts of colonization, and in the research, practice, and teaching and learning that we do, that we have a responsibility to support self-determination of First Nation, Métis, and Inuit peoples, and to continue to do the slow change work of making healthcare and educational spaces more welcoming for First Nation, Métis, and Inuit students, staff, faculty, and care providers and recipients, and to be more inclusive of Indigenous ways of knowing and doing. As director of the School of Public Health and Social Policy, I am so delighted to open this event on generative artificial intelligence and its implications for public health. Our school is rooted in values of health equity and upstream action to address the social and structural determinants of health. We offer a primarily online Bachelor of Arts in Public Health, an online Master of Public Health, and we are the academic home for the interdisciplinary graduate, master, and PhD programs in the social dimensions of health. These three programs, which we're very proud of, prepare future leaders in public health and social policy arenas to address the many complex challenges we face in today's world. Today's conversation reflects that spirit, exploring the strengths and challenges of emerging technologies and their potential to transform how we work, learn, and serve communities. This is our first event planned in a series of events to bring together students, faculty, public health practitioners, and our policy and public health community members to share ideas and build capacity in a rapidly evolving landscape. We see this as an opportunity not only to learn about Gen AI, but to critically examine its ethical, social, and practical dimensions in public health. We are also here to build our own community and connections, so thank you so much for joining us. We have three panel members who will be bringing different perspectives and insights on this important issue and to this conversation. The Gen AI panel will be moderated by Dr. Matthew Little, who is an associate professor in our school and a Michael Smith Health Research BC scholar. So with many thanks to Matt and to the panel, I would like to turn the session over to him.
Thanks, Kathy, for opening us in a good way there. I'm also very excited to be here and be moderating this session for everyone. As Kathy mentioned, I'm an associate professor in the School of Public Health and Social Policy at the University of Victoria. And I have used and currently use Gen AI in a number of different facets of my work, but I'm very excited to take the seat of mediator today and moderate the discussion between the three panelists and introduce them as well. So without further ado, we're going to get started here. And our first panelist is one of our own, Zahra Wright Cardinal, who is an associate professor in the School of Public Health and Social Policy. Zahra is Bush Cree. Her late maternal grandparents are Narcisse Cardinal and Agatha Desjardins. They were recognized healers in the Wood Buffalo region of Treaty 8. Due to genocidal policies, Zahra is the first generation born in the hospital who speaks English and was raised away from family and community and land-based worldviews and wellness practices. The importance of these connections is what drives her work to co-create community wellness frameworks that engage land, language, culture, and ceremony, crafting an approach to community wellness research, being a helper, where invited and guiding students with relational ethics. She is a Michael Health Research BC scholar for her research program, Sharing Medicine Bundles and Pathways to Community Wellness. She's also a 2022 recipient of the CUFA BC Academic of the Year Award. She's former president of Aurora College and a mom, community auntie, and mentor. So I'm going to hand things over to Zahra now for some opening remarks. And each of our panelists will give some opening remarks in succession before we open things up for a discussion with all of our panelists that I will moderate. And by the end of the session, I hope to also take some questions from the audience. So that's the format for today. So Zahra, I'll hand things over to you now. Thank you so much for being here. And I believe we've got some slides to share as well. So Julia, if you wouldn't mind putting those up, that would be fantastic. Thank you.
Miyokisigao, good day. Thank you for the introduction and thank you to everyone for joining. I'm calling in from my Treaty 8 homelands on the border of northern BC and northern Alberta, home to Dene Cree and Métis communities. It's a beautiful sunny winter day here. Slide 1. Indigenous knowledge reflects the unique cultures, languages, values, histories, governance, and legal systems of Indigenous peoples. Each nation has its own natural laws, ways of knowing, and ways of doing. Being in relationship with all living beings and honoring the spirit of each being is very important in Indigenous knowledge systems. Much of what we learn is through reflective practices. Indigenous knowledges are part of broader political, legal, economic, and cultural systems that enable the continued generation and renewal of Indigenous peoples to ensure our well-being. Knowledge should not be considered separately from its knowledge system. This is especially important for Indigenous knowledges, as there is a tendency to extract knowledge from Indigenous communities to consider it solely within a Western framework. This diminishes and disrespects Indigenous knowledges and ignores the important connection between the knowledge and the community and place it comes from. Slide 2. Indigenous scholarly protocols are nation-specific and will vary from nation to nation. Much of what we learn is in ceremony with elders and knowledge keepers, and when we are ready to receive teachings, it is often not meant for the public. Knowledges that are shared publicly must be with permission, recognizing the source, the nation, and the context. Cultural integrity is the practice of respecting and honoring the ownership of materials, traditions, and knowledges that originate from a particular culture or community. Our languages hold our worldviews, ways of knowing, doing, and being. There's a growing number of AI-generated books. Last year, a language learning book series came out that included several Indigenous language guides full of errors. Most of the authors listed could not be found online, and some books were falsely identified to be written by Indigenous language experts. After genocide and assimilation tactics in Canada, language revitalization efforts are very important in our communities. But because so few resources exist, it's easy for fraudulent language books to end up at the top of online search results. Gen AI synthesizes and summarizes without consideration of accuracy, permissions, copyright, or acknowledgement of authors, and cannot reflect the teachings of the land. Slide 3. IDS is the management of information in ways that align with the laws, practices, and customs of the community in which it is located. Key principles are: 1, Indigenous nations and peoples have the right to ownership and governance over data about them, regardless of where that data is held. And 2, Indigenous nations and peoples have the right to access data about them, often from government documents and historic or contemporary archival documents. Indigenous data can come in many forms, but in general, the data is created by, for, with, or about Indigenous communities. Indigenous frameworks such as the First Nation principles of OCAP, principles of ethical Métis research, and IQ, Inuit Kahumanuk, respond to and stand against unethical, extractive, deficit-based, and harmful research practices. In 2024, the Chiefs of Ontario identified discrimination by AI as a pressing concern. Algorithmic bias are outputs that are biased against certain groups and can be due to a number of factors, such as the design of the algorithm itself or the training data used. Risk factors for algorithmic bias include black box AI, AI designed without diverse input, and AI without a human in the loop. One of the solutions is developing AI systems in consultation with First Nations and Indigenous communities. Slide 4. The Abundance Intelligence Project involves 8 universities and 12 Indigenous community-based organizations in Canada, the US, and New Zealand. The goal is to broaden AI and bring a more holistic and inclusive approach to the field. Co-investigator Wanga discusses what it will mean to articulate, shape, and design AI through a Maori lens. He talks about putting family first. The Abundance Intelligence Project believes, in addition to developing a more ethical and equitable AI framework, building AI systems that learn from more diverse perspectives and values will result in better and more robust AI. This 6-year project will be completed in 2029. In closing, August 9 is the International Day of the World's Indigenous Peoples. This year's theme, Indigenous Peoples and AI, Defending Rights, Shaping Futures, is timely and urgent. Lucas Casosi writes, the rise of AI is a double-edged promise. Either it becomes a tool for empowerment, cultural resurgence and sovereignty, or it becomes a new frontier for colonization, misrepresentation, and resource extraction. AI systems today often fail to account for the complex, nuanced ways in which Indigenous cultures and knowledge systems operate. Without the active participation of Indigenous communities in AI development and governance, these systems are at risk of perpetuating historical patterns of cultural erasure and data exploitation. Hi, thank you all.
Thank you very much, Sarah, for those opening remarks. We'll move along to our second panelist now. So Zahra Premji is currently the health research librarian and librarian for the public health, social dimensions of health, physical therapy, and exercise science, physical and health education programs at the University of Victoria. Zahra is passionate about evidence synthesis and is an experienced search methodologist who regularly collaborates with research teams across disciplines on a variety of evidence synthesis projects. Her research and practice focuses on capacity building and training initiatives, evidence-based information retrieval, and increasing global evidence inclusion through comprehensiveness in searching. Zahra, I believe you do not have any slides for us today, but have a compelling opening discussion prepared here. So I'll hand things over to you and please take it away.
Thanks, Matthew. Before I start, I would like to take a moment to acknowledge that I am a grateful guest currently on lands very close to the University of Victoria campus, which is the territory of the Lekwungen, Songhees, and Kosatsam Esquimalt peoples, whose relationships with the land continue to this day. As a librarian, my connection to GenAI is in the information literacy context, which includes information seeking and retrieval, assessing relevancy, and critically evaluating information. Search behavior and information sources are core elements to the information seeking process, and generative AI tools relate to both. GenAI tools change how users search for information and can in themselves be used as information sources. This is true for chatbots like ChatGPT, which can answer from its training data, though most users should know not to rely on a chatbot as an information source for academic questions. There's another category of tools, sometimes called GenAI academic research tools or AI-powered scholarly tools, which use retrieval augmented generation, or RAG, where the tool searches an academic source, for example, Semantic Scholar or PubMed, and then generates responses based on a set of search results. Many of these AI-powered scholarly tools use either a subscription or a freemium model. In the freemium model, non-paying users get a limited number of searches, and the reports generated may be limited in either size, categories of data, or number of sources reported. Paying users get access to more searches and better features. While RAG tools, which search academic sources, are much better and more accurate than chatbots, factual accuracy is still an issue, and no tool guarantees 100% factual accuracy for a variety of reasons, which I'm happy to get into during the Q&A. In my work, I get asked about how GenAI can be used for literature reviews. And my advice is to think about what the tool does, how it works, how to evaluate it, and to think about what you want from the tool and whether the tool can actually deliver the results you expect. Let's start by thinking about the information seeking process. We start by articulating our question, which sometimes needs refinement. During this stage, we may explore the literature in an unstructured way. Then we have a reasonable question. We pick a source or many sources to search, which we know will provide comprehensive access to the evidence that we seek. We design a search to try and pinpoint the relevant citations. Eventually, we match the results of the search to the specifics of our question and have a set of studies to read and summarize. So how does a GenAI tool work within this search process? Many of these GenAI tools let you use a natural language query for your question, and some may even help you refine your question through conversation before executing a search. This ideation stage with GenAI tools can be very helpful for thinking through what you're interested in, and this is one of the tasks that is an accepted use for GenAI. The next step is to choose the source that you search. Well, you don't often get to choose the source that the GenAI tool searches, But as a responsible user, you should know what the Gen AI tool is searching. Many libraries have been pulling together comparison tables of the various Gen AI tools, and one of the data points is the database or source that the tool is searching. So this information is possible to find. You should ask yourself whether you would search only that one source if you weren't using the Gen AI tool, and think about why or why not, and what might be missed if you did so. Again, if the Gen AI tool is only one source you plan to search, but not the only source, then it's okay. The next step would be designing your search. Good searching considers diversity of language and terminology, and with many Gen AI tools, you don't get to see the search instructions it generates. The tools don't all use lexical search or keyword-based searches. Some use semantic or vector-based searching, and some tools use a combination of approaches. But this part is a black box in many tools. And many of the studies I've read show that searches in these tools are not as good when the topic has many lexical variants or uses diverse terminology. Eventually, the tool will generate a summary and provide you with citations, either at the sentence level or the paragraph level. To do so, it first ranks or evaluates the relevancy of each citation or abstract. It retrieves from the search and then takes the top 4, 8, 10, or X number of articles based on its ranking. While the generated summary is helpful for initial reading and for seeing trends, due to the near certain risk of factual inaccuracy, many of these tools should only be consulted and not used as fact. Also, many of these tools only look at the abstract of the studies, and so you can't trust the level of detail that they provide. As a researcher, you can use the citations as seed papers and follow the source citation to read the study, in the same way that we teach students to go to the primary source rather than accepting a secondary source, unless we have confidence in the authority and accuracy of the secondary source, which you don't have with Gen AI generated summaries. In the end, the only person who will be held responsible for the accuracy of the information you write is you. There have been many examples of the use of Gen AI summaries without verification, eventually leading to either personal, social, or other consequences, or in the worst of cases, real-world impacts to other people and their lives. So to summarize my main takeaway, which is based on my philosophy as an AI critical user, is to use these tools for ideas and leads, but never facts. If you cannot or will not verify the information from the Gen AI tool, you shouldn't be using it. And read everything that you get from a Gen AI tool with an extra layer of critical thinking. Like any other tool, you should understand what the tool is, how it works, what it does, but also why are you using it before you actually use the tool for a meaningful task. Thank you.
Thanks, Zahra. I think we'll have an opportunity to revisit a lot of those points during the discussion section of this hour. So I wanted to give an opportunity now for our third and final panelist to provide their opening remarks. So our third panelist is Dr. Muyi Iyamu, who is a physician and health services researcher currently working at the BC Centre for Disease Control and the University of British Columbia's School of Population and Public Health. He co-leads the BCCDC Digital Public Health Lab, where he applies implementation science, human-centered design, and equity-focused approaches to advance digital transformation in public health. He's a CHR Health Systems Impact Fellow, Vice President of the Public Health Association of BC, and Associate Editor with BMC Public Health. And his work explores digital determinants of health, including digital and AI literacy, public health workforce, digital competencies, and the sustainable people-centered design and evaluation of digital health services, such as BC's online STI testing service called Get Checked Online. Muyi, please take it away. Very excited to hear your opening remarks.
Thank you. And I'll just try to share my screen. Let me know if you can see it. Great. So thanks for having me. Today, I just want to present an overview. It's by no means exhaustive, but an overview of the opportunities and potential challenges for Gen AI in public health. I'll start by acknowledging with gratitude that the work I do is on the unceded traditional and ancestral territories of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh nations, and I'm forever in gratitude of their stewardship of these lands. I want to start by giving a disclaimer that I come from a perspective that really focuses on a bunch of issues around digital public health. But for the last 4 or 5 years, I've really focused around building health workforce capacity to address the explosion of technologies in public health, but also adapting our research and evaluation techniques to understand the broad impacts that they are having on public health outcomes. And I will lean on these when I talk about the opportunities and challenges for GenAI in public health. Much of what I've discussed today is drawn from work I have done analyzing some of the impacts with folks at Vancouver Coastal, the Public Health Association of BC, and across BC, generally speaking, where we have advocated for a more thoughtful approach to digital transformation, specifically around Gen AI in public health. I will start by just giving a few examples that may help to make it more practical in terms of our public health practice. So there are examples like the promise that Gen AI may help us achieve more people-centered communication and in health promotion, generally speaking. So this is an example from the WHO, where they implemented a health promoter called Zahra that helped to ensure vaping and smoking cessation practices and distressing within historically marginalized populations across the world. They have demonstrated that it's entirely possible, but through a more practice-based approach that focuses and centers equity and the communities that we serve. At the UVic, there's a lot of opportunities. For example, during COVID-19, we use natural language processing and Gen AI to be able to understand people's sentiments around COVID and our implementation of interventions during the COVID pandemic to then help us have more targeted messages to different communities. I think this is one of the more important or more exciting examples. So this is from Microsoft's AI for Good Lab, where they use both generative AI to increase the high resolution mapping of the impacts of earthquakes, wildfires, and flooding to then allocate resources during the emergency responses phase during natural events. And so these show that we can potentially be using AI to ensure the efficiency of our services and ensure that they are more responsive to local community needs. But beyond the opportunities in public health practices, because I think about public health workforce development, I think about the opportunities there. So for example, we think about expanding access to knowledge. I am a user of AI and many alongside me, for example, at the Network of Schools for Population and Public Health, and they have described the opportunities existing to, for example, teach people how to code and do data analysis without necessarily, learning the language from scratch. We've also talked about the increased capacity that it gives us if we're leaving some of the more task-based activities to then focus more on equity and community engaged work, where we are focusing on relationships rather than routine tasks. But this belies challenges that exist in the field. In public health, as other speakers have talked about, there's the risk of hallucination. That risk is front of mind because it can result in our loss of public trust, which is central to all the work that we do. But I highlight the social and economic inequities that can be exacerbated through these interventions on a broad scale. I say that because it's our role as public health practitioners to also advocate for broader social change and to track the impacts that social change is having on specific communities. So for example, there is current news about the impact of the spread of Gen AI and its impact on the entry-level workforce for now. It might expand further, but that's where we are currently seeing the impact most. But we also see the impact on the environment. So for example, we know that the expansion of data centers has resulted in, for example, large data centers consuming about 5 million liters of water per day and consuming lots of energy and resulting in about 300,000 kilograms of carbon emitted per model that is trained. And so we think about the impact on sustainability and planetary health. But as others have talked about, it might also and can perpetuate dis and malinformation, which is something that we have come to become used to during the COVID-19 pandemic. But for the workforce, there's also issues that we need to deal with. Well, we do not necessarily have the specific skills to navigate, and hopefully some of these conversations can help us start figuring it out. But one of the key pieces for me is the idea of de-skilling and lack of cognitive depth in our current conversation. So, for example, a few colleagues in Poland recently did a study where gastroenterologists who had been working with generating AI tools for 3 months could not necessarily or had reductions in their capacity to detect gastroenteric malignancies after 3 months of sustained use. The final example of issues that we need to consider is from work that one of my MPH practicum students did last year, exploring the focus on capacities for using AI within the health workforce. And the biggest focus was really on our capacity to understand the social impact that it can have on our work, but also our risk of this dependency and the ethical, legal complications that it can have on the work that we do. So for me, a techno-realistic approach would be to first begin our ideas on Gen AI with the communities we work with, building our tools with the communities and engaging them throughout the journey, but also investing in AI literacy from the schools that we currently work with, ensuring that people are trained to work in the real world where AI is available. And finally, we must focus on guardrails and leaning in on our roles as advocates for communities that are historically marginalized. And that will imply that we need to focus on evaluating the impact on different communities, evaluating the planetary impact, but also ensuring that we have an idea on the economic impact, generally speaking. Thank you.
Thank you so much, Muyi, and thank you to all of our panelists here. I'm very excited to get into some deeper conversation and have some back and forth now. And just for our audience, we have a Q&A section that I think there's a button down on the bottom of your screen that you should be able to find the Q&A there and type in a question or two as well. And so we'll try and get to some of those questions before the end of our session. And we've got several people here in the audience, and I know many of you probably have questions, so we'll see if we're able to get to them all. But anyways, if you want to engage with the speakers here and ask a question yourself, please feel free to do that, and we'll get to those questions a little bit later. I wanted to start with one of the, we've got several common themes here that the panelists have discussed altogether, but one of them is this issue of Gen AI potentially perpetuating systemic inequities that exist. And Zahra, you jumped into that conversation right away with regards to your perspectives and indigenous worldviews and the way that these may or may not be incorporated or misrepresented in Gen AI models. And Muyi, you also just mentioned systematic biases and inequities and how Gen AI can perpetuate these things. And if we're thinking towards kind of solutions to this challenge, recognizing that Gen AI is likely with us to stay and, will be incorporated into day-to-day life on an ongoing basis and an increasing basis. Zahra, you mentioned collaboration with indigenous communities, and you mentioned guardrails. And I want to kind of focus on those two things with regards to this issue of Gen AI potentially exacerbating systemic inequities. And just maybe if you could dig a little bit deeper into what that actually could kind of look like. What do you see as the roadmap forwards for both increasing collaboration with indigenous communities and other communities experiencing inequities to ensure that those perspectives are adequately incorporated into training data, for example? And then what guardrails need to be in place? And I assume we're talking about kind of policy guardrails here to ensure that those inequities are not exacerbated in these models and the outputs of these models. So up to you who wants to kick things off here, but I open up the conversation with that.
Zahra, would you like to go first?
Sure. Thanks. And thank you both for your great presentations. They're really informative. I can only speak from an Indigenous scholarship lens and an Indigenous community lens. And so if we think about the efforts that have been made over the past 26 years to create and have support for Indigenous research frameworks that are grounded in governance, ownership, access, control, and possession, by Indigenous nations, communities, and peoples, that can also be applied to this new era of generative AI. I mentioned the Chiefs of Ontario 2024 report on generative AI, and that report clearly states that there needs to be governance from Indigenous nations, and there needs to be Indigenous participation in the development of the tools. And so those would be the two strands, if you will. So I'll leave it there for a moment.
Thank you, Sarah, and thanks to the co-presenters. I really learned a lot from your work. I think if I had to answer this question, I'll come at it from two broad perspectives. One will be on the off-the-shelf tools that are deployed, generally speaking, which is the modus operandi for most health authorities within BC. We get commercial off-the-shelf tools, and then there are the custom tools. I think our capacity to engage is really mostly limited to the custom tools, which will be AI models that are generated in-house, for example, within academic settings and research settings, and then deployed in a research or a contained manner. Here I can say that there has to be a lot of focus on engaging with communities that you hope to serve. So most times these tools are designed with a specific focus in mind. So for example, at the UBC, there are many research clusters like ATech that are designing tools to help communities access care in more person-centered ways, and are doing a lot of work in, first off, engaging with the communities, understanding their perspectives, and establishing governance frameworks around who owns the data that's used to train the models, how it's deployed over time, and how the tools are evaluated over time. And this sort of presents us with a benchmark for how these tools can be deployed in practice. But unfortunately, that's research, or it's restricted to research content manner. The tools that have the largest impact are actually these commercial tools. Unfortunately, I'm not sure how many of us have as much of a say in how they are developed. I think that where we then have power is to try to do our advocacy work. It begins with us tracking and evaluating the impacts they're having on communities, telling the stories of communities that are impacted by the tools, and using that as an advocacy leverage to engage the political class, to engage those in decision-making capacities within the health authorities, to really try to clarify the roles that they are having with these tools, and potentially reevaluate how we patronize or not patronize some of these vendors, as it were. At this time, much of the frameworks we have seen put a lot of the focus on in-app capacity. So it's not really a structural effort. It's more about, here are frameworks for researchers. For example, in PHSA, I sit on the AI for generative AI for research working group, and it's a lot of guidance on how researchers can engage with the process, go through research ethics boards and review that process. But there needs to be more structural efforts to see how the commercial off-the-shelf tools are actually also representative of the needs, values, and priorities of communities that they're implemented in.
Thanks, Muyi, for those comments. Zahra, is there anything you wanted to add to this current conversation?
Only to say that the off-the-shelf tools, which are commercially based, have their own motivations, and that's rarely going to align with what specific researchers need, especially researchers who care about equity and diversity and inclusion and community collaboration. And so what needs to happen is the creation of custom tools, and that requires the skills in computer science, and then working with the researchers on ensuring that the data that they want is included. I mean, even thinking about search process today, the databases that we typically use for academic research aren't representative of literature from the Global South. We're already doing a poor job, and these tools are just going to exacerbate that when they do a re-ranking and then they pick the first 10 articles to then do a summary. Those rankings are often based on citation counts, Again, all of the same things that reduce visibility of research from the Global South, prioritize research from certain spaces. And so we're continuing to exacerbate that. And so these commercial available tools are not going to help us move to research from a better place.
Thanks, Zahra. So it's really contingent then upon the developers of these tools ultimately to make sure that they're purpose-built with this in mind, with this in mind of, one of the primary goals being to ensure visibility of research from diverse settings, essentially. Excellent. Thank you so much for those opening thoughts on that question. The next question I wanted, because we are a school of public health here, and I think a lot of people are coming to us from within our school and from other schools of public health across the province and perhaps beyond. And Muyi, you of course are affiliated with the School of Public Health there at UBC. And recently, the National Collaborating Centers for Public Health released the recent edition of the Public Health Core Competencies. And we in public health, we really use these core competencies as a framework for teaching topics related to public health, and in particular for Masters of Public Health students. And that is a framework that is used, I would say, consistently across all universities in Canada. And yet, when you look at that document, despite it coming out very recently in 2025, there isn't a single mention of generative AI in it. And you talked, Muyi, especially in your discussion, but both of you, or all of you, sorry, across the opening comments, about how important literacy is here. And I would wholeheartedly agree, as someone who has engaged, particularly with students who are using these tools, that literacy is a really, really crucial skill to learn as we engage increasingly with generative AI, not only as a user, but also as a digester of information that has been generated by other people using these tools, right? And being critically aware and able to kind of identify and critically evaluate other people's information that they've generated using these tools. So I guess my core question here is, should we be incorporating literacy, AI literacy, into the core competencies for public health education in Canada? And if so, what do you think are like the most important, kind of sub-competencies within that to teach students? Muyi, I see you seem eager to answer this question, so maybe I'll hand it over to you first to get us started.
Um, I could start, but please feel free to jump in. I think you reflect some of my sort of frustrations with the system. Over the past, I would say since 2023, I have worked with even some on the call here on digital competencies, broadly speaking, but then specifically on AI literacy and competencies. I will start by saying that I understand the process for creating the core competencies for public health in Canada. At least I got visibility into that process as part of my advocacy for digital competencies. And I would say that it has been challenging for that group to distill many interests, many perspectives, many apparently pressing issues and pressing competencies into one single document. And so while I am very aware that they had considered, broadly speaking, some digital competencies over time, eventually the final version, to my somewhat disappointed, to my disappointment, it didn't reflect some of the changes we had hoped to see. To answer your question more directly, I think that absolutely we need to be including AI literacies, but more broadly, digital literacies within the competency framework. We talked with Canadian public health practitioners across the country, I think in 2024. And what we heard was that they absolutely need these competencies, and they do from many perspectives. First, they generally need digital competencies to be able to deal with what they see in practice today, whether that's the new tools that are being introduced, but also the challenges that they engage with, people not necessarily understanding what they find online or accentuating or increasing the significance of some obscure facts that they have found on some corners of the websites they visit. And so I think it is important. Unfortunately, it doesn't reflect what we currently have, but there's opportunities to be engaging with schools of public health to think about ways to integrate it within the existing frameworks, whether that's in determinants of health courses, whether that's in, technical courses around analysis. I think that specifically we need critical literacies. Our ability to understand and evaluate the outputs that we get from Gen AI, to actually challenge the outputs we see, rather than taking it at face value, as Zahra had talked about, and to evaluate multiple sources before we come to our final conclusions. I think what that does, though, is that it increases our cognitive load, because now we get to look at a lot more information before we come to a conclusion. And the question is, how do you do that effectively in the world that we live in today? I'll stop here for now.
Thank you, Muyi. Zahra, I saw you nodding along there to a couple of the comments, so maybe I'll jump over to you for your comments on that.
Yeah, thank you. I see, like Muyi said, AI literacy is really just a part of digital literacy, which is a part of information literacy, which is a competency that we've been teaching students and researchers for a long time. But there is this clash between the purpose that or the reason we often use Gen AI is because we want to do things faster. And that becomes a problem when you need to verify so much more. Some of the things that we often use, markers of authority in previous times, that we use as a proxy for, I don't need to do the evaluation myself. I know this is a marker of authority. I can just proceed and take the information for granted. That is being lost when a Gen AI tool is repurposing information and repackaging it into a new into a generated summary, because we might have looked at the original source and looked at who the authors were, where they come from, who they work for. You can look at like commercial conflicts of interest, but when all you get is like 3 sentences from a source, and then it's repackaged with other sentences from other sources, you have to look at all of that before you feel any confidence in the answer. And so that those markers of authority that allow us to go quicker, they're lost. And so people have to do so much more work, but they have to recognize that they have to do so much more work, which is why that critical evaluation is so much more important with Gen AI than ever before with any other source.
Thanks, Zahra. Sarah, do you have some comments you'd like to add here?
Yeah, I think I could provide an example with my slides. I have 2 slides that I could share. I think this is a good time to share them. Because digital literacy is so important in PHSP, and I agree with my colleagues' insights. So what I want to share here, because as my colleagues shared, we're really talking about knowledge, knowledge that's created and how we synthesize it. And so how do we access that knowledge? What are the search terms that we use? And how do we understand that knowledge? What is, through this process, what is highlighted or brought forward, as Zahra shared, Global South scholarship is not elevated in the ways that scholarships here are. And again, I'll just share an Indigenous example where our knowledges are not easily understood without being lived, which includes non-Indigenous colleagues visiting our communities, being in relationship and having those experiences. So this is from my PhD work. So I created a simple theoretical framework for reformulating Indigenous adoptee identity. So as someone who experienced the 60 scoop, and in order to do good relational work, I needed to do my own self-location and sort of autoethnographic work before gathering stories with other 60 scoop adoptees about their processes of decolonization, reclaiming identity and connection to place. So I was working with primarily educational psychology and law literature for this. And so what I came up with here is a framework. And you can see the 2 blue lenses are in a hegemonic space of other, and the 2 purple lenses are in what I call a spirit-based discourse, a discourse of us and within Indigenous ways of knowing. And this is specific to those of us who were removed during the 60 scoop, during that genocidal policy. So develop eyes. this is the beginning of, as a young adult, through experiences in work, studies, and community, to start being curious about my Indianness and understanding the settler story of contact was both convenient and oversimplified explanation for complex relationships. So then I was able to look back at my childhood, and I named that colonize, because my critical consciousness was being awakened as an adult. I was able to look back at these colonial discourses of childhood, and that I was other in that space, being removed from my family and community in a closed adoption system into a white middle-class family somewhere else in Canada. So I was able to acknowledge or see this experience of inferiority. And so then that led me around to the bottom here. And you'll notice that this simple framework is from an Indigenous Cree way. It's circular and cyclical, and it takes us through the different stages of life. And so then as a more mature adult, my Indigenous eyes were awakened, and that offered better political and cultural identity. I was able to reclaim my identity and assert it as an act of decolonization, shifting from those blue hegemonic lenses to the purple spirit-based discourses. And then I offered that as we mature, we can go more deeply into this space of a strength-based space, into spiritualize, moving beyond the settler socio-political frameworks that we've inherited into Indigenous ways of knowing, by being in community, by being connected to our family and like our kinship. And so from there, we're in these beautiful Indigenous ways of knowing, such as dream and vision, where time shifts from temporal space and critical theory lands in another dimension. And so if you look at the next slide, this speaks to something Zahra shared in her opening remarks. The next slide shows a Gen AI comic of my framework of reformulating Indigenous adoptee identity. It's from one of those spaces that Zahra mentioned, that as scholars, we can put our articles in particular databases or spaces, and they are companies, and they are for profit. So if you pay as a user, you have more access and more information. I didn't pay for this. I just happened to submit it in after this article about my own journey was published in 2016. And then in 2017, with my dissertation, I speak in more detail, or I also speak to it. And so I received an email recently from this organization asking me if I would like to listen to a Gen AI podcast of my article. No, I do not. I do not want to listen to how an AI has understood the complexity of genocide in Canada, specific to the removal of Indigenous children and that experiment of adopting us into mainstream families. And so, but what I did do was I did click on the AI comic just to see what they would come up with. And it does not express in any way this framework that I just shared, what the scholarship that I drew on, and the deeply reflective effort to create that framework over a few years. This is a really simplified and misrepresentation from a very Western lens about, these struggles of who am I really, and many versions of myself and so forth. Every single aspect of this comic is problematic. So I'm taking up a lot of time, but I just thought I would share this, thinking about students who are here with us today, that we really do need to be careful, that it isn't a shortcut. Gen AI is not a shortcut, but it could be a helper tool in ways that my two colleagues have explained. But I absolutely caution the use when we are trying to understand or write about or synthesize Indigenous ways of knowing. Thanks.
Thank you, Sarah. And that's such a great example to at least partly answer one of the questions that came through in the Q&A from Ruba. And Ruba's a PHSP alumni from 2024. Thanks for joining us, Ruba. And the question itself was, do you suggest using AI for knowledge translation and literacy in public health? So, for example, when creating infographics or social media posts, is it appropriate to use AI as a tool to help summarize information and make knowledge more accessible to the public, as long as it's reviewed by public health professionals to ensure accuracy and appropriate representation? And I think you've provided an example of how sometimes these tools can misrepresent in graphical format the findings of research when we're feeding information or articles into the models. But I wonder if we can answer that question even more directly. Muyi or Zahra, if you have any comments on that particular question and how we might be able to use these kinds of tools for knowledge mobilization purposes.
Um, I would say use with caution. And specifically for infographics, I would say even more caution. And I would want to weigh the effort versus the reward at the end of the day. So for text-based output, it's obvious that you can review, edit with your team, and refine it based on your prior knowledge and experiences and relationship with communities. So that's a little more tenable. But when you think about infographics and image generation, I would say because I have visibility into some editorial processes, a few journals now are actually saying no to such AI-generated images for the same reason I will give you about being cautious. The fact that it is not reproducible, it is not editable, and so it is just the output of the machine and not necessarily yours. Now you can argue that you can try to include additional prompts that help you edit it, but it never produces the same image twice. And so when you consider all of the effort required to generate something that's close to what you had in mind, I would say maybe it's a little more useful to just go the traditional route for now. The tools are not there yet.
Mm-hmm.
I would like to add that it could be good for ideation, though. So if you aren't sure how to represent an image, you could ask it, like, I'm trying to create an infographic to explain this abstract. Can you provide me with 5 different ways that I might approach it? And again, it can inspire your thinking. So I would recommend using it for ideation, but not the specifics for images especially. And then the only other thing that I want to mention is that if you think about what the tool is at the base, it's still a predictive tool, and it predicts based on probability, which means it's more likely to go to the more popular interpretation versus a more niche interpretation. And so anytime you have a perspective that isn't popular or it's different, you're likely to lose that nuance when you ask the tool to do a summary or to generate something for you. And if it's that difference, that nuance that you're trying to get, you're going to lose it in the process of using the Gen AI tool.
And I would just add to that for Indigenous contexts, our knowledge is not meant to be synthesized. It's not meant to be generalized. It's very specific to each nation. And if we look at frameworks that do currently exist, there's specific First Nations frameworks, Inuit frameworks, and Métis frameworks. And within that, there are nation-specific frameworks being developed that are more specific to particular nations within those 3 larger population groups. And so it's just not possible to do that kind of search at this point with where we are at with Gen AI in an effective and appropriate way when it comes to Indigenous knowledge systems.
Thank you, Sarah. I did want to bring our attention, and Ruba, I see your hand up, and I hope that we'll get to you in a minute here. I did want to bring folks' attention to some of the conversation happening in the chat, though, because Linda asked in the chat if there's best practices or guidelines for effective prompts to train AI for the end user to get the best quality results. like composing prompts which require current evidence from the last 7 years. If there are these guardrails that you can put on the search or the generation of material when you're actually feeding instructions into a Gen AI model that would perhaps increase the accuracy of or the effectiveness ultimately of the output. Zahra, I saw you commented there in the chat, so thank you already for doing that. But I wanted to just bring this to folks' attention and offer Zahra another opportunity maybe to just reflect on that particular question in your own words here.
Yeah, I mean, this is work that I have been following for a while. And if you've been in the misinformation kind of space, then you already are familiar with the SIFT framework for evaluating information. And so Mike Caulfield is the creator of SIFT. And then with the Gen AI tools coming into focus, looked at how can we leverage the Gen AI tool to help us with the SIFT evaluation, and created this copy-pastable set of instructions that asks, like, so if you take a question that is controversial or where the evidence could be argued from two perspectives, asking it to kind of evaluate the authority of the source and all these other elements. And so there's creating this huge prompt that allows you to get the additional level of detail in order to understand kind of what is happening with that question. And despite all of this, so I mean, the question was about can you like, is there resources on effective prompting? And this example is an excellent example of a very detailed prompt that kind of shows how you can think through it. But having watched a webinar multiple times by Mike Caulfield, like, he still talks about there's factual inaccuracy. So despite all of that, and despite the level of nuance and detail that you can get the system to give you, you still need to do the human work yourself and that final verification. But this tells the system the kinds of information that you are interested in as part of your evaluation. And I encourage you all to check out the link in the chat.
Thanks, Zahra. We're really getting close to the end here, and I know that Ruba had a question, so I did want to provide an opportunity. I hope it's a quick one, Ruba. Would you like to come on and ask your quick question?
I was just wanting to add more context to the last question that I asked. And I know, like, a big part of public health is knowledge translation and how do we make knowledge more accessible to the wider and general public. So my question was more like using AI to kind of like break it down so you can use that information for infographics, not necessarily building an infographic through AI, but you would be doing that work and you would be feeding the generator, and they would kind of paraphrase or break it down into ways where it's like more accessible for public knowledge. But I really appreciated the answer. That was really well rounded. And thank you everyone for your time, and it's so good to see everyone.
Thanks, Ruba, and I hope we adequately answered the question in sense. I think that Zahra's point around using AI for ideation is a really strong one. It's about being able to kind of critically evaluate and assess the information that is generated and use it as a brainstorming tool in moving ahead, but making sure that we're ultimately like the outputs of research and knowledge mobilization outputs have a pretty heavy input from those of us who are ultimately the experts or the end users of those tools. So thank you so much to our panelists for being here. I'm going to hand things over to Kathy for just a couple of final words before we let everyone go. I realize we're basically at time, so if you need to leave, please feel free to do so. But Kathy, please wrap us up in a good way here.
Thank you, Matt, and thank you, everyone. And I will, yes, I see lots of people clapping and throwing balloons and hearts in the comments. I would just also like to thank our panelists, Sarah, Zahra, and Muyi, for such thoughtful and rich presentations, to Matt for facilitating a very reflective conversation, to our wonderful practicum coordinator, Heather Ulmer, for organizing the session, and to staff member Julie and Heather for our tech support today. And thank you all so much for your interest and attendance. My final pitch as we close: if you have any burning issues or questions you would like to propose for our next online event, feel free to email us. You can either email Heather at phspracticum@uvic.ca or me at phspdirector@uvic.ca. We welcome your thoughts and topics, and maybe as a volunteer panelist for our next session. So thank you again, everyone. I hope this session was thought-provoking and helpful for you as you take this forward in whatever you do in public health. Thank you for your work in public health, and I wish you all a good remainder of the day. Thanks, everybody.